Hello, we're discussing today RADD 2 for week 2. We're going to start with the structural analysis that we went over this week, starting by the sagittal dimensions of the spinal cord. This is a measurement from the posterior aspect of the body to the spinal laminar junction, and should be consistent throughout the entire cervical region. If there is abnormality where there's an enlargement, it is usually indicative of a space-occupying lesion. Next, we discuss the prevertebral soft tissue and the interspaces. The most common, like we've discussed in normal RADD 1 about the tracheal interspace, the laryngeal interspace, and the pharyngeal interspace. Dr. Bradshaw mentioned that the C4 region, the thyroid is typically located there, so the interspace will jut out. Also, the patient will complain of food getting stuck there, and the most common cause of this is a severe lipping or spurring of the vertebral body pushing out into the space. Another cause could be also a space-occupying lesion. Now we're going to get into the drawings. First one we discussed is the basilar angle. This is drawn from the frontal nasal junction, and if you have trouble finding this on an x-ray, it is located right next to the orbit of the eye. So we're going to draw a line from here to the middle of the sella turcica. And then a second line from the sella turcica, with the middle of the sella turcica down to the anterior aspect of the foramen magnum. When we take out the protractor, we measured that, and the normal range is 123 to 152 degrees. If it's outside this range, usually larger, it would indicate platybasia. Next is McGregor's line, and this is from the superior posterior aspect of the hard palate measured to the inferior aspect, the most inferior aspect of the foramen magnum, or the occiput. So we're going to draw it real quick. And then next we're going to measure the amount of the dens that is above that line. There's a difference between men and women in this aspect. Men, it shouldn't exceed 8 millimeters, and in women, it shouldn't exceed 10. If it is above that also indicates platybasia. Next is Chamberlain's line, which is from the posterior aspect of the hard palate, which is a little bit below McGregor's line, to the most posterior aspect of the foramen magnum. So the angle of the line is going to be a little bit different in this one than McGregor's. But in the same aspect, you're going to also measure the amount of the dens that is above that line. It should not exceed 3 millimeters. And again, it would indicate, if it's larger than this, it would indicate platybasia. The last line that we covered was McRae's line. This is measured from the anterior aspect of the foramen magnum to the posterior aspect of the foramen magnum. And then you would take another line and measure from the apex of the odontoid process straight up. The occiput is not to exceed that line, and if it does, again you're looking at platybasia. But you also want to make sure that the odontoid process is in the first quarter of the foramen magnum. If it's not, it could indicate that there's a fracture or a dislocation of the dens. We've mentioned platybasia a little bit during this video, and what platybasia is a congenital softening. Here we go. Let me just pull it up. Okay. It's a flattening of the sphenoid bone or the occipital bone, and we have 4 lines to measure this. It's not very common, but we have to know it for the test. Another thing that appears exactly like it is basilar impression. This is caused by disorder. Typically, it's going to either be caused by rickets or osteomalacia. A couple other disorder anomalies we went over. We discussed spina bifida, and spina bifida can be seen on X-ray if the spinolaminar junction from C2 down is missing. And there are two types. There's a colta, which is just a small opening and there's no clinical significance for this, or spinal bifida vera, where there's a large defect and you could have protrusion of the spinal cord, in which case you would want to stay away from that. It's thought to be caused by deficiency in folic acid in the first trimester of pregnancy. Now, if the spinolaminar junction is missing in C1, this is known as posterior spondylolisthesis, and it's again a non-union of the posterior arch. That is as far as we've gotten this week. Take care.